And in this work, we explored the relationship between in-shoe pressure measurements and fear of falling among non-community dwelling elderly. And yes, of course, 5 years later, I'm really glad to present it at this conference. So firstly, let's have a look why the root plays an important role in maintaining the balance. We should know that the foot is the direct interface between our body and the ground, and thus it allows us to sense the ground. It gives us some sensory information. And this sensory information can generate a corrective postural reaction via the muscle contractions. Therefore, the sensory information which are provided by our feet can be considered as a part of the system which can allow us to maintain balance. However, a decline in the foot sensitivity can occur, among other things, with the aging process, but also in different peripheral neuropathies, such as the most common is diabetes, as an example. This decline in the foot sensitivity can decrease our ability to maintain balance and increase our risk of falling. In our work, we focused on the older adults. We should know that annually, 1/3 of older adults fall at least one time, and these falls may result in a reduced level of independence, a poor quality of life, high levels of anxiety, and also an increased mortality rates. And among these people who have already fallen, up to 92% of these people may experience fear of falling. And the fear of falling may result in activity restrictions, an increased risk of falling, an increased risk of accidental death, an increased risk of physical injuries, poor quality of life, and also reduced social interactions. So the objective of our work was to investigate if plantar pressure measurements might help to understand mechanisms involved in the risk and fear of falling. And based on the literature, it seems reasonable to think that plantar pressure measurement might be used to evaluate balance during walking. And let me give you some examples. Firstly, as mentioned previously, the foot sensory input, depending among other things on plantar pressure, plays an important role in maintaining balance. Secondly, the hallux plantar flexion strength, which can be measured by peak pressure, has already been determined as a predictive factor for falling, as well as the foot placement. So the foot placement, which can be evaluated with foot plantar pressure analysis, has already been determined as a predictive factor for falling. So in this study, we recruited 27 non-community dwelling elderly who were able to walk 10 meters without walking aids and who understand spoken and written French. All the participants were living in nursing homes in Brussels. The participants who already had a history of stroke or surgery during the past 6 months were excluded, as well as the participants who had major psychological disorders. All the participants provided written informed consent approved by an institutional medical ethics committee. So the initial part of our protocol consisted in filling the Swiss-French version of the short FACI questionnaire. This questionnaire is a questionnaire which has been validated to assess the risk of falling, and it has been validated among a population with cognitive impairment. And based on the cutoff points of Delbar and Al, we determined 3 groups: a group with a low level of fear of falling, a group with a moderate level of fear of falling, and a group with a high level of fear of falling. After 1 week, the participants performed a 10-meter walking test with standardized shoes and the F-scan in-shoe pressure measurement in soles. Then, in order to calculate an average pattern, the vertical ground reaction forces was normalized to 100% of stance phase and body weight. We determined the three subphase of gauge stance manually. The weight acceptance phase was determined as a phase between the initial contact and the first peak force. The single limb support phase was determined as a phase between the first peak force and the second peak force, and the single limb advancements phase was determined as a phase between the second peak force and the two off. Regarding the statistical analysis, we performed a Kruskal-Wallis test to determine the differences between the groups. We adjusted the alpha values by a factor of 5 to correct for multiple comparisons, and only the data related to the left side were considered, since the right and the left data appear to be well correlated. Regarding the main results of our study, among the 27 participants, 16 were women and 11 were men, and the average age was 82. 7 participants belonged to a group with a low level of fear of falling. 10 participants belonged to a group with a moderate fear of falling, and 10 participants belonged to a group with a high fear of falling. The low and moderate groups, so the groups with a low and a moderate fear of falling, had a significantly shorter weight acceptance relative duration compared to the high group. In addition, the relative peak force during weight acceptance was significantly higher for the low group than the high group for the hallux. Reversely, for the first metatarsal head and the hindfoot, it was higher for the high group compared to the low group. The present study suggests that a relationship exists between a prolonged relative duration of the weight acceptance subphase and a fear of falling among elderly. It may be speculated that people with high level of fear of falling may find achieving initial stability being more difficult, and thus they may compensate their impaired balance by needing more time in that subphase. In addition, force measurements in different regions has notably shown differences in relative pressure and the hallux, with higher values observed in the low group compared to the high group. The findings are in line with previous studies, highlighting the role of hallux flexor strength measurement measured as a relative peak force when evaluating the risk of falling. Our study presents different limitations. The first one is that the study sample was small. Secondly, the Swiss-French version of the short FACI questionnaire has yet to be validated. And finally, while the short FACI questionnaire is able to assess the risk and the fear of falling, the cutoff score that we use in our study were the cutoff score of the risk of falling. So here are the references of this presentation, and yes, if there are any questions, just please feel free to ask them.